My family is senior lecturer at audiologist and speech therapy department in our hospital for more than 25 years. She is my teacher. She is going to be talking about developmental milestones, the pre-time period.
At the onset, I would like to thank the organizers for making me a part of this cochlear implant group update. Sorry, not the group, but the update. And my title, as you can see, is Milestones in the Development of Communication. I have emphasized the word communication here for obvious reasons which will become apparent as I go ahead with the presentation. Just a brief introduction that we've all been talking since morning about the early intervention program, and the prerequisite for this early intervention is early identification. And of course, it is desirable, as Dr. Murali pointed out, that we should have universal newborns hearing screening. Unfortunately, we are still not ready for this. Dr. Murali already spoke about it. And we are therefore taking up children in the high-risk register for the screening programs. And of course, we do electrophysiologic measures, which needs high technology equipment, and unfortunately, this may not be available at all the centers in the interiors of our state itself, and therefore we still need to depend on the developmental checklists, which depend on the behavioral observations that we need to look for in any developing child. And therefore, the behaviors that we need to observe, which eventually evolve into communicative behaviors, which are supported in the child's development in the domains of sensory, motor, cognitive, and social. And the development in each of these domains facilitates the development in the other domains. And since we are going to monitor the development of the child's communication, we are going to observe, we need to remember this fact that communication does not develop in a vacuum, that is in isolation, but it does develop as a separate system of behavior. Does not develop as a separate system of behavior. And experience constitutes the basis of all behaviors, and communication is no exception, wherein we are trying to say that the child needs to have wide and varied experiences in his early years, in all the domains that I just listed. So a quick look at the developmental hierarchy of our communication systems will help us understand that how experience helps a child to associate the mother, the visual picture of the mother, along with the experiences he's had with the mother, along with the auditory symbol, and he develops an inner image about the mother. Then he starts understanding the word mummy. He starts speaking that after that, and then when he goes to his nursery, he learns to write mummy and read mummy and then write mummy. So this is the hierarchy, and therefore the development of the auditory verbal language is a prerequisite for developing the other communication systems. So the focus of this presentation is going to be developmental milestones in the auditory, cognitive, and the expressive domains. And in the auditory domain, I will be highlighting about the normal hearing, how the process of learning to hear takes place, the prenatal hearing, and the auditory maturation. Normal hearing implies the whole skill of detection, discrimination, identification, and comprehension. This very often we take it for granted, that the child learns comprehension very easily, but we have to see how in the early months the child learns to detect the sound, and this is very obvious when we find the child's responses. Like for example, when there is a sound and the child stops doing what he did, or he stops crying, it tells us that the child is able to detect the sound. Then when he is able to discriminate between his mother's voice and a stranger's voice, we know he is discriminating, that is whether it is the same voice he hears always or it is different. And identification takes place when the child starts imitating the sounds in his environment, and comprehension is when we ask the child a question and he appropriately answers us. So that's when we say that the child has started having comprehension hearing. And therefore, normal hearing is a special skill dependent on learning, and it will happen only when the child is immersed in an auditorily stimulating environment. It's unfortunate that we are using the same term normal hearing for reflexive hearing, which is present at birth, and comprehension hearing, which develops over a period of time. And as we heard in the morning panel discussion, how do we really know whether the child is benefiting from the cochlear implant or not? We really need to monitor his development in this area, whether he's developing comprehension hearing or not. Now, we all know that hearing is elusive, but the process of learning to hear is even more elusive, because there are certain conditions that are necessary to learn to hear, but which are taken for granted by most of us. And therefore, its importance is going to be highlighted here, because the parents particularly need to know that the child needs to have these experiences if he has to learn to hear. The right age, that is the critical age period, I'll be elaborating a little later on this, and that the sounds must be loud enough. We all, when we hear a word for the first time, we need to hear it loudly and clearly. And this facility is provided to the child very naturally, because when the child is cuddled in the arms of the mother's mouth is close to the child's ears, and therefore he hears loud speech, which is quite a facilitator. And the sounds must be heard often enough. Again, mother's instinct to keep repeating, that also helps. The individual attention that the child gets, the love and affection, and of course it does take time. The child is not going to develop this overnight, so we need to be patient, and of course a prerequisite is child's intelligence. Now, coming to prenatal hearing, there are a number of studies which tell us that the fetus is physiologically prepared to respond to sound, and that by the 20th week of gestation, the human cochlea assumes normal adult function. This demonstration of fetal hearing contradicts the theory that the child is born a tabula rasa. That means he's born with a blank state, which is no longer true. Of course, we have heard about Abhimanyu during the Mahabharata, that Abhimanyu knew the way into the Chakravyuh because he had heard from his father when he was reciting the path into the Chakravyuh. Only that, because he went off to sleep in the latter half, and therefore he didn't know how to come out. So we have evidence of that way back. There are a number of studies which again endorse this view. They have found that the fetal heart rate increases in response to high frequency sounds, and they have observed oropalpebral reflexes in a fetus 24 to 25 weeks. And this, of course, observation has been done in another study in about 236 children, emphasizing that. So, having seen the prenatal hearing, now neonatal hearing, there are a number of responses that we can elicit in a newborn child, starting from startling responses to the child recognizing mother's voice and becoming quiet. He does increase or decrease his sucking behavior in response to different sounds, and we observe a calming effect during the hearing of the low frequency sounds, and high frequency sounds have a more violent reactions. A number of studies have observed these responses, and what is interesting is that within the first few months, the children are showing an extremely precise auditory ability to differentiate, and they are able to contrast, perceive the differences in the phonemes. That means they are able to differentiate between per and ver, and this has been observed when they have given the child a non-nutritive nipple to suck, and the increase and decrease of his sucking behavior has given this evidence that the child is able to perceive the differences. Also, the child is able to perceive the changes in intonation and stress across bisyllables. If the stress is in the first syllable or if the stress is in the second syllable, the child, the infant is able to perceive these differences. Once again, they have been able to do this by observing different responses in the child. Now, what is significant to the clinician here is that speech-like signals seem remarkably effective in producing responses in newborns. And this is very often done when we do behavioral observation or geometry with children. Now, how does the auditory maturation take place? It begins with the child discriminating the strangers and the familiar voice and the voice of the familiar people. Without going into the details, I would like to highlight about how the child develops localization of sound, and this is an important milestone that we need to observe in a child, whether he started localizing sound or not. And Northern and Downs have given us how very pictorially how well the child can start localizing right from early months. That is, in the newborn, you will just see a little arousal, and how. Can I have a pointer, please? And how by 7 to 9 months the child is able to localize the sound to his side, and how by 24 months the child is able to localize sounds in all the directions from any angle. Now, this maturation is an important milestone, and clinicians always look for these responses in a developing child. And of course, it's very obvious why we need to know this maturation, because once the course of maturation of the auditory response is understood, the hearing testing techniques follow naturally. Now, the basis for full language competence, we can see it is in the ability of the child to process language into discrete elements. That is, the child is able to hear a continuous flow of speech, and yet he is able to identify the individual sounds and yet he is able to segment an almost continuous acoustic input into discrete elements. So this is where the child is endowed with this facility. And so far we've seen the passive responses that the child is making, but we do have evidence that the child is active in regulating the auditory events in their environment. And with the help of a study, they could prove that the infants could control the onset and offset of tape recorded music. Having briefly covered the auditory domain, I move on to the cognitive domain. Now, cognitive domain is a very important domain which needs to develop along with the auditory domain, and it becomes very often a prerequisite for some of the auditory behaviors to develop. As we all know, cognition is where the child is getting all the experiences from the environment, classifying them, categorizing them, and forming his own schema, and that becomes a basis for learning language. So the cognitive development in 0 to 3 months, quickly I'll just highlight how the child starts preferring movement and contrasting visual patterns, and he starts visually searching for sources of sound. He begins to follow moving person with the eyes and watches person when spoken to, and how by the age of 2 years, that is by 24 months, you will see these other milestones. That is, does the child laugh at a peekaboo game? Has he started enjoying that? Does he like repetitive play? Now, what's important is the object permanence, the development of the concept of object permanence. That is, the child can look for an object which he is no longer able to see in his environment, and also the deferred imitation. That is the child able to imitate something in the absence of the actual stimulus? That means he is able to imitate after a while. and this is a prerequisite for speech. Now we know that in the early months the child has infant cry, that is a reflexive cry, and also the vegetative sounds. Basically these reflect the child's discomfort and the comfort levels, and in the recent times we've had a lot of studies on infant cry analysis, where they are able to judge the medical status of the child, analyzing the infant cry. Probably the children are crying hoarse, telling the medical profession that all is not well with me, please try and do something for me. So the child has started communicating through cry. Now the vocalization of infants up to 5 to 6 months, this is an interesting observation, that in normal children who are hearing, their vocalizations do increase when the parents speak to them, but they have also observed that when parents talk to the hearing impaired infants, their vocalizations also increase. This may give us an indication that the child who's probably not hearing, but the parents may think that he's hearing because his vocalizations have increased like any normal child, but the studies show that it's not related to the speech sounds he or she hears. It is just a pre-adaptive reflexive response which appears at the same age in a hearing impaired child or a child who's hearing. Now moving on to an important milestone in the child's development of expression is babbling, which again matures as the child grows older, because the child has been experimenting with his oral mechanism, and he is now mature to produce adult-like sounds. So by 4 to 6 months, there is what we call marginal babbling, that is burp or a burp, and later on he deduplicates these into a string of sounds, and then later on there is a larger variety of sounds or consonants and vowels which come into his repertoire, and after that is the child's ability to imitate adult-like speech, and then he's able to imitate the intonation patterns of those around him. So this is an important milestone that people around the child should observe. And there is a lot of importance of babbling for the development of language, because it's a milestone that is predictive of eventual communication skills. And the auditory feedback loop is present at birth, and it is important because for a hearing impaired child, he has lost on this experience, and therefore the further development of the variegated babbling and all will come to a standstill, unless of course he's been fitted with amplification. Now expression in the age of 1 to 2 years, we must observe that the child is increasing every month his vocabulary to express, uses some 1 or 2 word questions, and puts 2 words together. Now what is the relation of cognitive development to language development? If the child is able to categorize objects, see the similarities, the characteristics, that becomes a basis for the child, semantic basis for the child learning words. And similarly, when he's using the objects and knows the gestures, when he's, like for example, using a spoon in the form of a gesture, we know that it is a precursor for labeling. And similarly, the deferred imitation, as I mentioned, the fact that the child is able to internally represent a particular action, we know that there is a true symbolic functioning that is developing. And similarly, the object permanence, where the child is trying to look for his object, do an action to look for his object, that is a precursor for triggering of speech. So now the optimal period, I think enough has been spoken about it, and because of the time limitation, I will just say that there are a number of studies which say that the first 2 years are very important. This particular study, where children who were admitted to school before 2 years, and in the 2 groups, those who were admitted prior to 16 months did very well when they were evaluated at the age of 40 months, much better than even those who were admitted between 16 to 24 months. Now this is what we mean by a developmental checklist for 0 to 1 month. If we have these developmental checklists which parents and children around, individuals around the child are able to look for these responses, then our job becomes easier. We can take up these children for further testing. And so there are a number of warning signs for every age group, which can include both motor and other developments. But I need to just warn that these are all predictable stages and ages for development, and the range for normality is quite broad. So normative data is just a guide, not a diagnostic tool. So because individual development depends on a large number of factors. Thank you.
Professor